Maria, hello, come in. Hi Maria, looking lovely. I've got the camera, come in, come in. Maria, thanks for coming in today. So I understand you're having some fillers done, is that right?
Yes, I am. I'd like to get the top lip done up here. This is the last part that I just need to get done because I was worried about this area here and my top lip because I've had this done and this, it looks so nice. And also around my eyes, and I've also had this bit done here. So now I've just got to do this.
Beautiful. So this is like your cosmetic journey then, isn't it?
It's been waiting for a very long time. I've actually really wanted to do this for years. So because my skin is very soft, it falls quite, and in my age now of 53, I found that I really need to do something for myself.
Lovely. So Maria, what we'll do, obviously Maria has had fillers before in the past, but we will go through the consent form and we'll go through it again. So as you know, Maria, the filler is a man-made product of what we call hyaluronic acid, which we have naturally in our bodies as well. It does contain a local anesthetic within it, so it will get number as the procedure goes along. That hyaluronic acid will integrate with your natural hyaluronic acid over a period of 2 weeks. Yes. So just like the other fillers you've had done, it will look great today, but it'll look even better in 2 weeks' time, which is wonderful. Fantastic. As we're doing the lips today, they will swell up. Now, I always tell my patients lips are going to swell because they're highly vascular. Yes. That means that today and tomorrow they'll look very swollen and you'll think, oh my gosh, what have I done? But after 3 to 5 days, that swelling will go down and you'll get your natural look, which is what's going to be, yes. And then probably, in about 2 weeks' time, you're going to say to me, hey, Dr. Nora, I really want my lips that I had 2 weeks ago when it was all puffed and swollen, because that's what everybody says. And as you said, risk, so every procedure does have its risk, and it's important
and I
to know.
think about the risks every time you tell me.
Beautiful.
And I'm willing to take that risk because I've taken risks for everyone in my family, so I'm going to take a risk for myself.
Fair enough, lovely. What we'll do is we'll sign some consent forms and we'll take your pictures, the before and afters. I'm using an application at the moment called Treatment Pad, which allows me to take pictures of Maria in the split screen, so I'll just show you what I mean.
That's awesome.
It's really cool. So this is Maria previously when we did a treatment for her last week, and I can use this to compare the pictures before and after. Righty, so Maria, just a natural face for me first of all. Lovely, and now give me a smiley face with a closed mouth. Closed mouth, that's it. Lovely. Now the great thing about Treatment Pad is it allows me to take the correct angles of the patient as well, so I'm maintaining an accurate picture. And the important thing about maintaining the correct angle is if patients are slightly malrotated, their lips may look bigger or any features may look slightly distorted. Just natural face to start with. Beautiful, there we have it. So we've taken our before pictures. Now it's time to get ready for the injections.
Yes.
Yay. Any procedure, always make sure you wash your hands thoroughly because you don't want to get any infections. We definitely don't want to be spreading any viruses. So I want to make sure my patients are nice and safe before their procedure. Now, first things first is to make sure that our patient is nice and numbed up because as we said, the fillers, they do contain a local anesthetic, but it is uncomfortable. So I'm going to be putting a topical anesthetic cream on the top, make sure it's nice and numb. It's going to feel a bit tingly, Maria, with this. But hopefully that will help with any discomfort. So we leave the local anesthetic cream just working for a couple of minutes, and whilst we're doing that, I'm going to make sure the rest of my trolley is ready. A little bit though, just so we're not bending down.
No problem. Oh, they're definitely numb now.
Oh, good. Excellent, excellent. So the important thing is always making sure the area is nice and clean because again, we don't want to be getting any infections there. And I always like to make sure that we prime the needle beforehand, which means making sure there's no air bubbles because we don't want to be injecting air into her lips. No way. So we make a small bubble and we dispose of that. Okay. Okay, Maria, so I'm going to start with your top lip first of all. And what the idea of this treatment is to try and just bring out your lips, make sure they're nice and hydrated, trying to reduce the lines of these fine lines you got on the top here. Yes. And then we'll also feed a few through here as well, just to reduce those wrinkles that we've got there. No problem at all, pleasure. Okay, so just pop your head back a little bit for me, that's it. Okay, and open your mouth a little. Okay, first injection is going to scratch, sharp scratch now. Well done. So it's really important with filler that we're only doing small boluses at a time using the linear threading technique, which means that we're constantly moving the needle because we want to avoid any sorts of vascular compromise, which means if we put too much into an area, that can actually block up the arterial supply to the lip, which can cause cell death. So we definitely don't want that. So I'm doing nice, steady, linear threads, small amounts at a time, and constantly reassessing the lips. And actually, as you can see, the lip has started to pop out a little bit. I've only popped in 0.1 of a mil, and you can see we're starting to get a nice curve of the top lip over here. Doing really well. The nice thing about this product, Maria, is it's a very soft product, so it just moves really nicely. So we'll massage at the end. Beautiful. Now what I'm going to do is a couple just on your Cupid's bow, just to bring out that beautiful, nice heart shape. Well done. Well done. Beautiful. And we're just going to do a couple on the lower lip now. So I'm using the fanning technique at the moment, which means one injection point with multiple linear threads, just so that there's less injection points for my patient, so it's a bit more comfortable for her as well. More for me, thank you. So with the lips, Maria, they do bruise, they do swell. So if you do have some bruises, that's absolutely normal. That will settle down after about 3 to 5 days. So don't be alarmed. Beautiful. Lovely. And just close your mouth for me. Oh, look at those lips. They look nice, don't they? My goodness. I think I want to show you what they look like.
When can I kiss them?
Tomorrow, not today. That is actually a really common question. Men will always ask their wives, when can I kiss your lips? Yes. Tomorrow. Wow. Tomorrow. Don't get anything. I haven't finished yet. I've still got 0.4 of a mil left, but I really, we don't want to get infections or anything. They look so gorgeous. Oh my goodness, I'm so excited. Okay. So now we're just going to make sure they're nice and symmetrical, and then we're going to address some of the other lines over here. Okay. Sharp scratch for me. Okay, and now I'm just going to do a couple of vertical threads, which will just help to bring out that lower lip, make it nice and rolled over. Beautiful. Now, one trick that I always like to do whenever I'm doing these sort of procedures is to give some structural support to the oral commissure, which is these corners of the mouth here, and we do that by injecting a little bit of filler. And what that does in this corner over here, that just helps to uplift the smile and give it some nice support so that we're getting a good frame for our lip fillers. That's it. So just 0.5 ml into the oral com, either side, just for that structural support. Beautiful. And on the other side as well. There we have it. Treatment is complete. Lovely. Well done. So it's not quite, you're welcome. Not quite over yet. We're going to do some massaging, make sure that there are no lumps and bumps, and then Maria is free to see the results. I'm excited. So with these fillers, Maria, you can expect them to last up to 6 to 9 months in total. Obviously, because we're always using our muscles, our lips, it will not last as long as, say, for example, your jaw, which can last up to 2 years. So it's important to bear that in mind. But that doesn't mean you're going to go back to your full loss of volume in the next 6 months. You're going to retain some of the filler. And at that point, you can always come back and get a top up if you need to. So here, just massaging any lumps or bumps, making sure that we're not leaving any nasty lumps in Maria's lovely lips. And in terms of the massage, I will do the massage. You don't need to do any of the massaging. So today, just leave your lips well alone. Don't put any makeup or lotion, no kissing. So we don't want to get any infections in those beautiful new lips. And then, as we said, bruising, inflammation, that will settle down over the next sort of 3 to 5 days. Your lips will become a lot more swollen tomorrow, then they'll settle down. If it is uncomfortable, use some Panadol and an ice pack tonight, but hopefully it should all just settle in nicely. So this one is just making sure that Cupid's bow has got a nice triangle. So trying to set that mold in. Oh, they look lovely. And then open your mouth for me a little bit. Just going to massage those lines. Lovely. So what I'm going to do is ask you just to run your tongue on the inside of your mouth and just feel if you can feel any lumps or bumps. Good. So Maria, you can sit up and have a look at your brand new lips.
Thank you so much.
You're welcome. Let's take a look. Yes, look at that. Oh my goodness me, look at that. That's incredible. So I'm just doing the after pictures now. Yeah, so different. And we're going to go through our pictures. So smiley face with a closed mouth. Oh, they look so beautiful. And a smiley face with a big mouth. Yes. So with this application, I can actually literally instantly, take Maria's before and after pictures and show her straight away how she did. So this is the before picture, and if I scroll to the after picture, I can, with a tap of a button, align the pictures up and then save that. I know, I can't wait. I'm going to show you them all. I'm going to get them all ready. So let's take a look. So this is your before, this is your after. What you can actually see as well, if you notice, obviously your lips are fantastic, they look gorgeous, but look at the upper lip.
Yes.
We've really kind of evened out those hits. So we fed a couple of mils just through this area here as well, just to try and smooth it out. And it will get better as the 2 weeks progresses as well. But the lips look gorgeous, they look so good. Look at that smile. And you've got a gorgeous pout as well. Your pout is just phenomenal. It's Maria, you look stunning. I'm so pleased for you. It was so nice having you, Maria, and doing your lips. This is a beautiful outcome. It's what we always strive to do. And I think what Maria is saying, any age, obviously making sure that you're fit and healthy, no medical conditions, as long as you've spoken to your doctor or your medical professional.
Yes,
then
absolutely. Yeah. I would definitely seek medical advice first. Yeah.
Oh, Maria, thank you so much. I look forward to seeing you in 2 weeks' time. You look after your lips. Remember, nothing on the lips. Don't rub it, don't touch it, don't play with them.
No.
Tomorrow, everything can resume as normal.
Yes.
Not a lot of excessive heat today on your mouth or no saunas, no hot showers.
Okay.
And not a lot of exercise as well. Nothing to get you perspiring, basically. So nice and chilled out today. Drink plenty of water. And then from tomorrow, you can enjoy your lips. You can kiss your partner. So there we have it. A beautiful, successful outcome with our gorgeous patient who just wanted a little bit of a boom into that upper lip and get that definition back. And as you can see, she had a beautiful result, and I managed to show her before and after pictures on a treatment pad, which she was just amazed at the quality and the speed of the pictures and how it can rotate the pictures around. So thanks for watching, guys. If you have any questions, please don't hesitate to drop me a line in the comment section below. But for now, take care and stay healthy.